Good morning, everybody. This is our third speaker in a lineup of very eminent speakers this morning. It's my pleasure to welcome and introduce to you Simon Denegri. He is the National Director for Patients and the Public in Research at NIHR, the National Institute for Health Research, and also Chair of Involve. He has a background in communication and leadership, much of which is in the voluntary sector, and he says his interest is in how patients engage with science, and particularly through being involved in research. And in Prime Centre Wales, we want the members of the public, we want patients to be involved in the research that we do. And my role is to lead that in the centre. I recommend to you his blog, which is a very lively insight into some of the issues that he faces in the work that he does. And he's posed the question in that public involvement in research is often like coming into a foreign country. And he says that our role is to welcome people and to provide a map and to tell people something about the culture. So I'm sure this morning that he will be our guide, a very informative and very interesting guide into that world. Thank you very much.
Thank you for that introduction, Bridie. I'm always pleased when people ask others to read my blog. That helps my statistics go up when I look at them every day. And yes, I am the same person who's in your brochure under the biography. I have grown a beard since that photo was taken. It's the Jeremy Corbyn look. That's all the rage for London Fashion Week, but I did tell someone I'm not going in disguise. I'm not running off from NIHR. This is still me. I am still with NIHR. So, seriously, it's a real delight to be with you today at the launch of the Prime Centre, and I've been really encouraged and quite excited actually by what I've heard already throughout the presentations. And I got a very strong ethos, a sense of ethos and commitment to public involvement, particularly from Adrian in your remarks at the beginning about mutuality and the commitments of co-production. And so I feel very positive and optimistic about what that future is for Prime working with its public contributors. So what I thought I might do over the next 20 minutes, I know I'm standing between you and lunch, so I promise I will try my best to keep to time. What I thought I'd try and do is a couple of things. One is I'm just going to very briefly tell you the National Institute for Health Research approach to public involvement, because I think that might be just helpful for those who haven't come across it before. I want to talk about why I think we need to involve the public in the big conversations that matter around healthcare, and in particular how we fund research and what we fund research into. I'm then going to talk about what I think are the three great challenges in public involvement, working with research and researchers, and then I'm going to conclude about what I think public involvement shouldn't be about, but I sometimes worry there is a danger of it becoming. So let me begin by just sort of outlining for you where the NIHR is coming from in terms of public involvement. And I know many of you have heard this before, but I think it's worth rehearsing, because ourselves, along with Health and Care Research Wales and our colleagues in Scotland, are, I think, leaders in the world in terms of incorporating a public involvement philosophy in terms of how they work as government funders. But it has been a core principle of how we run our business since 2006, so we now have 10 years of applying this in a funding setting, and as some of you will know, we spend over £1 billion on research and infrastructure each year. We very much have tried to embed public involvement and our approach to public involvement from top to bottom of how we do NIHR. So clearly we are quite a distributed family of many different organisations and entities and activities. And so we've tried to build a public involvement infrastructure that goes with that. So not just people to lead the work, but a community of public contributors, as I call them. And so in the beginning, our public contributors might have numbered a few hundreds. But now we are into the many thousands of people who are sitting in advisory groups, they're part of trial steering groups, they're doing lay reviewing, a range of activities in which people are now involved, patients, carers, members of the public who are helping us do our work. And I think that's a very powerful statement. I think from the very beginning we've tried to set a very clear expectation with researchers that this is how we're going to do things. But we've also tried to do that in a partnership way. I think it would have been quite easy, as we all know, to have quite an antagonistic approach to applying this. But we have tried to apply it through partnerships over time, and I think over the years just set the bar a little bit higher for the people who are coming to us for funding. So you'll know that now, as in Wales, people, when they come to us for funding, they have to set up a public involvement plan, they have to detail their public involvement budget, they have to say how they're going to deliver that, and then they're required to report on how they do that every 6 months and annually. And I think that's very important. It's seen as part of that overall system approach and the way that we are accounting for ourselves more broadly to the general public. Critical, I think, is open and sustainable funding. Involve is one of our main mechanisms for providing public involvement. I'm sure many of you have heard of Involve, which I chair, and we give about £500,000, £600,000 a year to that. But we've now, with the recent contract that we've renewed, will have done that for 15 continuous years. And this is the sort of area where you need to give sort of really solid and sustained support to build it and to insert it into what you're doing. And I know you're also committed to doing that. And I think the last bit, and perhaps Fiona will talk about this more this afternoon, is trying to do this in a very open and transparent way. So, but not just in terms of how you're doing it, but also meeting the growing, I think, desire, need, requirement of the general public out there to see greater transparency in how research is done and what it reports. So for us, reporting our results, making sure that people are aware of those, is as important as involving people in the how. Not just because it's a sense of it's about proving our accountability. It's also actually thinking that actually that is data, those are results that form an important part of the evidence base on which they might be able to rest their decisions about their own treatment and their own care. And I think that's going to be really important, quite a complex issue, but a really important issue in future years. And I think the last point about this slide is the quote there that you'll see from the Chief Medical Officer in England, Dame Sally Davis, and Director of R&D. And I always put up that because I think one of the critical things for delivering public involvement in any organisation is leadership. And if you don't have it led from the top, and if you don't have that leadership at different parts of the organisation, it is really, really difficult for public involvement to thrive. And I include patient and public leaders in that. So leadership is a really, really critical thing, I think, for public involvement to go forward. So I hope that's a helpful introduction to where NIHR is coming from. I'm going to talk a little bit in a moment about our 10-year view of where we go next with it. But I wanted to actually, just wonder if this is going to come. But we have also done that, I think it's worth saying, with it, increasing dialogue with our partners in Wales and Scotland and Northern Ireland. And I think I hope the people who are here will agree, I think there's a really fertile dialogue now, a real sort of learning from one another about how to do this. I know that whenever I come here, and I've been fortunate to take part in several exercises where public involvement's been part of it, I know that I have learnt a lot, and I've also stolen ideas and taken them back to England. And I think that's the way that we develop and make ourselves stronger. So I did want to just add that. So, let me just start talking to you a little bit about what I think are the bigger conversations that we need to have with the public when it comes to public involvement. So many of you may not be aware of this. This is the UK Health Research Analysis. So there's been 3 of these reports published over the last 5 or 6 years. This one came out over the summer, and basically it's done by the UK Clinical Research Collaboration, which brings together many of the partners who run clinical research across the United Kingdom, including each of the 4 nations' government funders. And in essence, it's a report of how much is spent on research, both activity and also infrastructure, and also where it goes in terms of disease areas. And I can remember when the first one of these was produced, I remember the discussion at the time amongst the funders about how they really didn't want it to be used as a strategy document, to sort of direct future funding. And so it hasn't become that, which is interesting in itself, but that's not really the point. The point is that this has therefore become a sort of rather passive report of the three to £4 billion that's spent on research across the UK. And every time I look at this, I always think, well, this is very interesting, because even if I did a rough back of the envelope assessment of the amount of that money, the amount of that research where there has been lay involvement, I would say it's probably about a third of that, if I'm really being generous. So a third of that funding, third of that £3 to £4 billion has any lay involvement. And so then my question would be, if I'm an ordinary member of the public out there looking at this, is so if the public were more actively involved, maybe we increase that to 60%, what would that picture look like? Would it look like the same as it is in that report, or would it look different? Would we be seeing more money going into prevention, for instance, research? And if you look at the analysis, you'll see that prevention gets a very small amount of money, although it has increased. So I think we live in an environment where I think people will be asking us those sorts of questions, and they will be wanting more of a say in how and where we put our funding, and rightly so. So we have to think of the mechanisms by which we include people in what is quite a strategic discussion, help to ensure that's informed, and also so that we can be sure that the research that we fund tomorrow is actually going to also meet people's priorities and needs. And some people have taken this off into more academic research, so some of you will be familiar with the work of Ian Chalmers, based in Oxford, and James Lind Alliance initiative, and the research that he's done with others, which asked patients, particularly in arthritis and rheumatoid arthritis community, what their priorities were around research, and only 9% of those wanted more research into treatments. They actually, the vast majority, about 80%, wanted more research into things like quality of care, fatigue, pain, those sorts of issues. So I often look at this, which is often put out there as a celebration of the funding and how well we're doing, and rightly so, and think, well, if we put this through the filter of the public, what would they say about where that funding is going? And I think that's, in essence, the conversation that we increasingly need to be having. So I was quite pleased to hear the Minister talk this morning about prudent healthcare, because I think that's the sort of conversation that we also need to have under the banner of prudent healthcare. And I think we often think that that's a conversation that we can't have, or the public aren't well informed enough to have, or they don't want to have it, but actually none of the evidence bears that out. So this is survey evidence that's from the Public Attitude Survey around science, which the Department of Business does every 2 to 3 years. It's fairly standard format, and large-scale surveys and public dialogue work. And consistently, we get a readback from that, which is the public do want to be more involved in how we're taking decisions about where our research funding goes and what we're looking at and what it could mean for society. And people often point to the second bullet, 3 in 10 of us would be willing to get involved. I think that's quite low. But actually, when you compare it to the number of people who go to church, I think it's pretty high, actually. That's a pretty big body of people that we could be working with so much more deeply and so much more broadly to help us do what we want to do. So I think we need to think about this as a really broad partnership that we need to be developing over time, and we are perhaps just at the beginning of that. And there are all sorts of, I think, exciting possibilities if we get a little bit braver and courageous about having that conversation and begin to work with people both at a strategic level but also at how level. And And we've done a little bit of that thinking in NIHR. So we did quite a big review exercise last year. I don't ever want to go through it again, called Breaking Boundaries, and we published it as the Going the Extra Mile report that you can see up on that slide. And so in that report, which is really about how we get better at doing public involvement across the NIHR-wide system, so it's a little bit inward-looking, perhaps more so than I would have liked. We try to give a sense of some different direction to how we want our work to progress. So the first of those is in terms of the bullet point, the first bullet point up there, which is trying to articulate a vision which is more about the community and population than it is about individuals. So one of the things I would say about public involvement currently is very obsessed with having individuals on groups and committees. And absolutely, engine of science is having committees, isn't it, and peer groups and all those sorts of stuff. But we need to think more in terms of communities and population groups and neighbourhoods. So to try to expand our horizons and be reaching out more than expecting people to come into our house and work with us. But also to try and ensure that our methodology and our thinking and our evidence base behind public involvement is such that we can put it on the same status and the same footing as accurate measurement is regarded in research. So, that sounds like a very understated comment, but actually it has lots of connotations and consequences. But it really is, I think, where we should be going with our work. We also set out 6 strategic objectives about what we want to do. And one of our problems is, I'm sure you have it, that we have a very distributed family of organisations, as I say, and distributed community, all of them going off in different directions. And that's great. And of course, there was a time, perhaps in the time when we had more money as an NIHR, which we would have let many flowers bloom. Well, we are not in that luxurious position anymore. And I think one of our real challenges is to encourage more cohesion and coordination across our public involvement community. So that's why we do have our new vision and mission. That's why we do have strategic objectives now that will be rolled out over the next year or two. So we are trying to, I think, bring things together into a more cohesive way, set the bar slightly higher for our work, and hopefully that will be influential to others. But I think there are 3 what I call grand challenges in going the extra mile, which I think are where researchers and the public could really come together and make real strides. And these are sort of articulated in the report as areas where we need to think about how we measure public involvement. But I think there's something much deeper here for me. So the first of those is in terms of reach. So we've already heard presentations this morning about inequalities, but I was reading on the train yesterday coming over here how the population in Wales is becoming ever more diverse. Isn't that true of everywhere? In fact, funny enough, myself and Nero had a conversation on the phone because I was doing some work at East Midlands Clark a few weeks ago, and of course they have an extraordinarily diverse population. So we need to think about our models and methods of public involvement which will enable us to reach into an ever more diverse population. And that's why I think, and it was interesting when we did the review, that our lay voice on the review panel was rightly insistent that we only made 11 recommendations, but that one of those 11 recommendations should be around equality, diversity and inclusion, and about making sure that was how we thought about our reach out into the broader population. And I actually think that this grand challenge, if you like, puts prime and primary care research, health and social care research more broadly in the front line, because I also think public involvement has been besotted with things like clinical trials, it's been besotted with hospitals, and it also needs to get out there into the community. And so I think Prime and organisations and ventures like it could really be providing a very, very strong lead here and providing the innovations of the future, and I think that's genuinely exciting. The second one is in terms of relevance, and it goes clearly there's a link to the slide I showed you about that UK health research analysis. And don't get me wrong, I am not trying to advocate that we should put things to a democratic vote. Absolutely not. But we are wanting to create a much more balanced portfolio of research. And one of those is having better mechanisms by which patients, carers, service users, the public can be involved with us in setting research priorities. So as some of you will know, through NIHR we host, we support the James Lind Alliance priority setting partnerships, which enable patient communities and health professionals to come together and identify the top 10 treatment uncertainties in that particular condition. And we've done about 25 of those, about 250 treatment uncertainties have come out of that. There are probably about another 26 on the go. Really, really good. But I think there's two challenges here. One is to track whether these are actually being taken up by funders. It's all very well setting priorities and saying these are important, but we're not doing the work to say, actually, are funders picking these up? So I was interested, Jean, that you showed the Alzheimer's Research UK story, because actually it got me very hot under the collar yesterday. One, because lots of the headlines were 1 in 3 children going to get dementia, which I thought was a rather bad piece of campaigning on their part. But it felt like a bit of self-promotion behind their own research, which was really about drug treatments. And I thought, well, if you put that through a service user prism, would they have been arguing the same thing? I bet they would not. If they were a really patient-led charity, they would be saying something completely different. So I think there is something about setting those priorities as funders, how we do that, but then how do we make sure that that's picked up? Because people are going to ask us, I was part of this exercise, did you ever do anything? And if you didn't, why didn't you do anything? Because what was the point of him asking me? So I think relevance is going to be a real hotspot for us, and I think is going to be a grand challenge. And then the third one is around refinement. So I think there's two dimensions to this for me. One is that is a little bit of the impact agenda, which I think we need to do a lot more work on in the public involvement community, is demonstrating the impact. But actually we do have some quite good stories to tell about efficiency and effectiveness, or greater efficiency and effectiveness that you can derive from actually involving the public in how you do its research, your research, and actually I think gives us a competitive advantage in some respects. But we do need to do, I think, a lot more work on the methodology that we're trying to use in public involvement currently. And when I sort of go abroad, as I occasionally do, it's very interesting to me that in the United States and Canada, they are piling money into this bit. Absolutely piling money into the methodology and thinking about new and novel methods of doing public involvement. We do tend to think of our public involvement again in terms of workshops, open space events, advisory groups. Again, I absolutely applaud those. They're meat and drink to what we do. But we also need to accept that people out there are putting a lot of money into doing different things and more creative and innovative things. And I would hate us to fall behind our international competitors in terms of how they're thinking about it. So Canada, for instance, is thinking about setting up a methodology hub purely on public involvement. So this is very interesting to me, and I think it's great that you've got it as one of your planks in the centre, looking at methodology, and I hope you include public involvement in that. So I just wanted to finish in the last 3.5 minutes and 2 slides with some final comments. So as you know, in a sense, public involvement is the bit in the middle, and as important to me, I know this can sometimes irritate my public involvement colleagues, but as important to me is the public engagement and participation agendas around that. So that is getting a better dialogue with the public out there about research and encouraging them to participate in research, whether it be trials or social studies or whatever. So we do have another policy document out there called Promoting a Research Active Nation, which actually I think you're one step ahead of us, because you've almost declared that as a goal, whereas we've been a little bit humble about it. And so that's everything from our OK to the Ask campaign, which runs across the NHS every International Clinical Trials Day in May, to say to patients, it's not just OK for you to ask about taking part in research, we actually want you to do that, and people are ready to hear that message, and we've got things that you can help us with. through to the sort of classic ambassadorial work that I think patients and carers are doing. So increasing number of our NHS trusts in England now have patient research ambassadors who are working alongside our R&D office, being there as a meter and greeter to other patients, actually looking at studies alongside the R&D office, thinking about how to recruit from the local area, real partnership in action within a health setting. Hopefully we can actually push that out much more into primary care setting. I think that could be the really exciting bit. And then lastly, giving people online mechanisms. Sorry, the banner's just hiding that a little bit, like our Joint Dementia Research website that we've partnered with you and others on, which is about giving people an online method to register their interest in taking part in research, but also enabling researchers to go online and identify potential participants. And that is a real success story. It was launched nationally live in March. It's got about 12,000 people registered already. I believe the conversion rate of people into studies is around 1 in 5, so it's very good. And I think probably a lot more productive than traditional methods of recruitment. So hopefully we might be able to expand that through the UK Clinical Trials Gateway across all conditions. So this agenda is very, very important to me, and I think it's very, very important to involvement. I think one of the dangers that we have involvement, and I was talking to Bridie about it earlier, is that we must be careful that we don't inadvertently create a religion called public involvement, which has a certain credo and belief, and we expect everybody to bow at the altar to it. Because actually that's not true to our origins. Our origins were about being inclusive, they were about being flexible, they were about partnership. We really need to think about trying to engage the whole population in an activity called research and enable them to choose the contribution and the way in which they want to do that, whether that being helping to design a new trial, or whether it be actually just talking to their neighbour about research and the things that have helped them and the evidence that they've seen because they've been part of something. And I think if we can get right, I think we can see more of this sort of behaviour happen across the system. So this is a social media campaign called Why We Do Research. It's very popular at the moment. It's sort of having a little bit of a lull at the moment, but it came out of one particular NHS trust in the south of England. It's been people taking pictures of them with explanations of why they do research, and it's going everywhere. It's just a homegrown local campaign that's got national presence and actually motivating and encouraging people and enabling them to be part of this thing called research. And I think the world of research works better because of it. Thank you very much for listening to me.